The federal government says a controversial trial to drug test new job seekers will help reduce the nation's ice epidemic. 3 locations across the country are set to put welfare recipients under the spotlight, forcing drug users to spend welfare on goods and services they actually need. Bo Pearson reports.
The coastal WA city of Mandurah casts a pretty sight, but it's hiding one of the worst drug usage rates in the country. A household survey found illicit drugs are used in the area by nearly a quarter of all residents, almost 10% more than the national average.
There is clearly a problem here with the consumption of illicit drugs, particularly the drug ice, which needs to be dealt with in an honest and clear-minded fashion.
The city is also one of Australia's welfare hotspots and is one of 3 locations to trial the drug testing of new job seekers.
No one loses a cent of welfare for testing positive. This is a system designed to identify people whose drug use is creating a barrier to employment.
Those who fail the tests will have their welfare payments quarantined or even axed. The local mayor only found out about the plan this morning, but is supportive.
It's an issue, not just isolated to Mandurah, but if we can try and see if this works down here, then I'm more than happy for it to go ahead.
The community has also been offered Commonwealth funding to cope with increased demand for drug treatment, rehabilitation and counselling services. The extent to the nation's welfare cost has also been revealed. New figures show more than 100,000 lifelong welfare recipients have cost taxpayers $15 billion over the last 10 years. 19,000 Australians have been getting New Start handouts continuously for 10 years at a cost of $2.7 billion, while almost 89,000 people have received job seeker payments non-stop, costing taxpayers a further $12.6 billion. If legislation is passed, the trial will begin in Mandurah, Canterbury, Bankstown and Logan in January 2018. Bo Pearson, 10 Eyewitness News.